Welcome to Focus on Seniors, a television show sponsored by Helping Seniors of Brevard County, Florida. The show is designed to make you aware of senior issues, needs, and resources available to help us age in place and with dignity. This show will help you as you develop your own aging and care plan. Now, here is your host, Joe Steckler.
I'm Joe Steckler, and welcome to Focus on Seniors, the television arm of Helping Seniors of Brevard County. Our show is designed to bring you information on how to develop your own aging and care plans. Our topic today is Senior Care 101, and you'll see why I call it 101. But joining me today is Nancy Deardorff, registered nurse, and she's the branch director for Gentiva Home Healthcare. Welcome, Nancy.
Thank you.
Our topic today is a loaded topic. It's a very lengthy topic. We have 28 and a half minutes, so I'll try not to get into personal stories today, and we'll let you talk the whole time. But having said that, with all the changes in home health care and healthcare delivery, the desire for privatization, for managed care, for different things that we're doing to drive down and contain the cost of care, I think seniors and those that care for seniors have got to have a better understanding of the options that are available to them and understand what those options are. So the first question I would ask you is, why is it so important for seniors to understand the terminology of the industry?
Well, because it's such a quagmire of, it's a maze. It's very hard to know. I think we talked about on the radio, how do you know what you don't know?
Right.
Okay, and the other thing is, how do you ask a question if you don't know what to ask? And so it's important for people to understand terminology to be able to generally navigate the healthcare system and access those resources that we have right here in Brevard County. And many times people don't research that information ahead of time. How many of us, look ahead to a year or two, or what if this happens? Usually we end up researching something when we need it.
Right.
And if we're having a healthcare crisis, the last thing you want to do when you're in that crisis is be researching. So it's really important for people to start educating themselves on the community resources, healthcare resources that are available right here in Brevard, so that when they do need them, there's not that urgency to who do I call and when. And there's a couple of very simple things that we'll be talking about on how people can figure out what they don't know and what questions to ask and who to call when they need help answering those questions.
So the first thing I want you to talk a little bit about is, what is Medicaid and what is Medicare? They are not the same, and invariably people think that when they need Medicaid, they're going to get Medicare, or when they need Medicare, Medicaid is going to cover. And it's not true at all.
It's not. And I'm not going to claim to be an expert on Medicaid, but generally speaking, Medicaid is a state health insurance program, a state assistance program.
Right.
You have to qualify for Medicaid, and Medicaid is not designed solely for people over the ages of 65. Okay? There's Medicaid available to children. So think of it in terms of state insurance, state assistance. Medicare is a federal insurance program, and Medicare, generally speaking, is designed for people that are 65 and older that have put into the system and earn that Medicare benefit when they turn 65. Although it's important for me to mention, there are certain folks under the age of 65 that qualify for Medicare based on disability, end-stage renal disease, and a variety of other Medicare programs.
Okay.
Generally speaking, we're talking about people 65 years of age and older for Medicare.
Okay.
So it's the difference between state and federal. Some of the benefits with each of them are similar. Some of them are very different. Sometimes they can work together nicely as an adjunct to one another, and sometimes not. So that's the essential difference, state assistance versus federal assistance.
What is Medicare A?
Medicare, well, we had a great show about that not that long ago on the radio, the ABC and Ds of Medicare. Medicare Part A Most of us that are 65 years and older get our Medicare card in the mail.
Yeah, wait a minute. Now, you can't say most of us that are 65
all right,
and over.
most folks.
You're not 65.
I'm not there yet,
okay,
no.
all right. Okay,
So,
most folks 65. All
okay,
right.
on the first day of the month of your birth date that you turn 65, you should get a Medicare card in the mail. And it will say hospital insurance, and it may say supplemental insurance.
Okay.
Medicare Part A is also known as hospital insurance. Medicare Part A, called hospital insurance, can be a little misleading because it pays for more than just a hospital stay. In fact, what I do at Gentiva Home Healthcare, or in home healthcare, our main payer is Medicare Part A. Now, there's differences in what Medicare Part A pays. It pays so much of a hospital stay. It does not cover 100%. It depends on how long you're in the hospital. Medicare Part A also covers up to 100 days in a skilled nursing facility, and that's up to. Okay. Again, a lot of, you asked me to speak briefly about it, and it's hard to because there's a lot to it. So it covers hospital care, it covers nursing home care, and it covers home health. The beauty of Medicare in home health is, or the beauty of the home health Medicare benefit is, it is the only healthcare entity in the United States where there's no copay, no deductible, no limit. As long as the patient qualifies for home care, has a prescription for a doctor, has a medical necessity, and is considered, and it's difficult for that person to leave the home. So it's really the only healthcare insurance plan I know in the venue of home healthcare that doesn't cost the patient a thing. So those are the essentials of what Medicare A covers.
Now, how about B?
Medicare Part B is called supplemental medical insurance. Medicare Part B is something that most people opt to purchase. There is a premium involved. It's very small, a premium per year, and it's well worth it. Most commonly, when we think of Medicare Part B, we think of coverage for doctor's office visits. That's where most people use it. Medicare Part B covers 80% of the Medicare approved charge for that doctor's visit. So there is a 20% left over for the patient, but Medicare Part A does not cover for physician office visits. You can opt out of Medicare Part B if you don't want to pay for it, but I can't imagine why anybody would not want it.
You've got an expense to pay there, so you've got a very cheap insurance that covers the cost of that. Mm-hmm. If you don't buy that, you got to go out and buy some private insurance.
Right. And and I want to point out, on top of Medicare Part B, many folks also have what they call secondary insurance. And sometimes when you go to see the doctor, your Medicare Part B will pay for the 80%. Sometimes that secondary insurance will pick up that extra 20%. It just really depends on the insurance plan people have. But covering 80% of a doctor's visit is well worth it. So that's Medicare Part B. I should also mention pays for certain durable medical equipment, wheelchairs, walkers, hospital beds. But again, you have to qualify for all this. So I don't want our folks out there thinking, well, I have Part B, I can go get a wheelchair, or I can go get a walker right now.
You have to have a doctor's prescription.
You have to have a prescription. There's certain criteria Medicare has in order for you to qualify for certain pieces of equipment. That's why this is so hard to talk about briefly, but it's a nice overview. But that's essential to Medicare Part B.
If we can excite people enough to think about what they're trying to do, and we can give them some ammunition to help ask the questions. Mm-hmm. That goes back to asking about what you don't know.
Correct.
Part C.
Part C, Medicare Part C, very simply, is Medicare Advantage plan, sometimes called Medicare HMOs. And it is usually run by private companies, and it is where people opt out of their traditional Medicare Part A benefits and they sign up for a Medicare Advantage plan. Most insurance companies across the nations have a Medicare plan they have commercial insurance, and oftentimes they have a Medicare plan to go with it. They're called Medicare Advantage plans. I think probably people know from the radio, I'm not a huge fan of them. While I think they're necessary, there's a very small demographic of folks that actually benefit or get the advantage of a Medicare Advantage plan. I'm a huge proponent of traditional Medicare, and if you need prescription drug assistance, combining that with Part D, which we'll talk about in a moment.
Yeah, but before we leave Part C, and correct me if I'm wrong, Medicare Part C, our Medicare Part A covers any place in the United States. You can use any place.
No, sir. No, sir. Not necessarily. Medicare Part A pays for any place in the United States. If you sign up for a Medicare Advantage plan, Part C, basically that's the same as Medicare Part A benefits with stipulations.
Right, but my point was, Medicare, you can use Medicare any place where you can't use Medicare Part A.
But not Medicare Part C. We see it all the time. If you are a snowbird, if you're a traveler, and you think you might need health care outside of your state, many Medicare Part C or Medicare Advantage plans do not cover any medical services outside of the state with the exception of emergency care. We see it all the time. We had a patient recently that came down to visit his daughter, became very sick, could not travel back to the state where his Medicare Advantage plan was. We were willing to accept that Medicare Advantage plan's payment terms. They would not approve services for this very ill man. And it left the family in quite a quandary there.
So I cannot understand why anybody would opt for C
when you have A.
When you have A, I don't understand
I can
it.
tell you why.
Well, for a gym.
I can tell you, Medicare Advantage plans many times woo people, and oftentimes they express to people that you have the same exact benefit under this Medicare Advantage plan as you do with traditional Medicare. Theoretically, you do. But if you think about it, a Medicare Advantage plan is in business. They're in business to make money. How do they make money? The less services you use, the more money they get to keep.
Right.
Okay. And the advantage, I asked a very wise lady at the Shine that left a couple of years ago. You know her. Lynn Meager. I asked her once, what is the advantage of a Medicare Advantage plan? And she said, you really want to know? I said, what would drive a person to sign up for that instead of keeping traditional Medicare? And her answer was, you really want to know? And I said, yeah. She said, free gym membership. Which is great if you go, but a lot of people sign up for a gym and don't go.
That's exactly true.
Now, don't get me wrong. Medicare Part C has its place. If you have a very unique situation with medications, you may need a Medicare Advantage plan. Otherwise, I highly recommend traditional Medicare Part A combined with a good Medicare Part D prescription plan.
Okay. That's a quick down and dirty on A, B, C, and D. But let's talk for a minute about what I always refer to as elements of care. We talk about daycare, assisted living care, home care, nursing home care. How about helping people understand progression from care element to care element, and we have insurances to help cover. You do a good job of describing that. Let's let our people know about that.
Well, I think first and foremost, you always want to think the least restrictive and the most independent environment of care possible. Now, there's no substitute for acute care or acute hospitalization. If you need to be hospitalized, you need to be hospitalized.
Right.
But we're living longer and longer. People are sicker and sicker. There's more chronic diseases out there. Hospital stays are much shorter than they used to be, if you think about it. I remember when I worked at the hospital, I would have the same patient day in and day out for like a week, 10 days, 2 weeks. Many hospital stays are just 3 or 4 days. But the patient still needs care. So the question when they leave the hospital, and the hospital helps people figure this out, is what level of care do you need next? Excuse me. Some people are going to need nursing home care or stay in a rehab, and that's absolutely necessary. Other folks are going to need a less restrictive care environment like home care. So the hospital discharge planners really help people figure that out. So it really depends on what level of care a person needs as to whether they go to a wonderful place like Sea Pines Rehab. In your case, no better place for you to have gone as a step down from the hospital.
Yes.
Whether you go to a skilled nursing facility for rehab, whether you can go home. And then once somebody is recuperated or recovered enough to become a little more independent, there's still help out there if you need some help. There is non-skilled home care, which is somebody who can come in and help make meals, remind people to take their medications. Some people can do a lot of things on their own, but they need reminders, or they won't get up and cook for themselves. That's the least restrictive environment in that case. And then, of course, there's senior daycares, which are awesome for somebody who can't be left alone and their loved ones work. It's an ideal solution, or their loved ones need a break. You say you have an elderly parent living with their daughter or their son, and they need to work. there's a lot of daycares around Brevard where that senior, and it's not all dementia care. There are dementia care daycares out there, but it's not all dementia care. And daycares are wonderful. It's like a club. I mean, there's activities, there's nutrition. A lot of them have nurses on site. So that would be a good option for somebody in that kind of situation. There's a plethora of options out there. The tough part about it is people don't know what they are. And I think that is the advantage or the benefit that we have with helping Seniors of Brevard, is that our goal is to be a one-stop shop for patient and community, not just patient, I shouldn't say patient, community, education, and resources.
I recently had Jennifer Helen, who is one of the owners of Seniors Helping Seniors.
Yeah.
Jennifer described a situation where they had a family, it was an extended family. The mother and father lived here in Brevard County. The children lived outside of Brevard County. The mother and father were at that point in their life where they couldn't drive and they needed to go to the doctor. They needed some help with meal preparation, changing light bulbs and yard work, things like that. She was able to provide a 2-hour service a day, 2 hours a day, at a cost of $36 times 30 days, and the cost was $960 a month for her to go in there every day of the week and make sure they had all these little things taken care of. Had she not been able to provide that service to them safely now, they would have been in an assisted living facility, and for two of them to be in an assisted living facility,
$4,000, $5,000, $7,000 a month.
A month,
yeah.
Right. And here they were in their home.
Right.
But who in the care system, when we talk about terminology, we have elder attorneys that help you with estate plans and long-term care insurance and everything else. But you brought out our new organization, Helping Seniors of Brevard County. Our ultimate goal is to have counselors established that will know everything that you and I are talking about today, such that when somebody calls them, they can not only say that, well, you could call this phone number for Seniors Helping Seniors, but you might think about this, because from what you're telling me, you need a little bit more.
Right.
And I happen to know that your nurses at Gentiva and your case managers do that very thing. Mm-hmm. They do it. Not all nursing services do that. Nor are there that many really. It takes a special person to be a case manager. You just can't go out and hang a shingle out and say, I'm a case manager. That doesn't mean that you're going to get the right care to the right person.
Right.
And if we're going to cope with the many unknowns of the healthcare delivery system, we're going to have to be smarter about putting together our own plans.
No doubt. People need to be more actively involved in their health and their plans and their future plans. And again, planning is the key. Not worrying about what you need when you're in a crisis, but planning ahead. It's key. We're living longer. There's more diseases and illness. And people, you mentioned at the very beginning, people are going to have more trouble getting access to care in the future, you're going to see.
Yeah. One of the things that, you mentioned private pay and insurance. I've had an elder attorney, Bill Johnson, on several television shows, and Bill has talked about the value of estate planning, thinking in terms of, will I have enough money to retire on? Will I have an adequate plan in place to pay for my care? And you brought that out. You said many people think about it at the last minute. Mm-hmm. If you wait until you're 80 years old to buy long-term health care insurance, yes, it's going to cost you a fortune. Mm-hmm. And the chances are you're not going to qualify because of a pre-existing condition. Mm-hmm. But if you think about planning ahead, I was in my 60s when I decided I wanted long-term health care insurance. and I was able to get a plan for my wife and myself, and it costs us about $5,200 a year. Many people say, I can't afford $5,200 a year.
That's true.
But there are many that can afford to do it. And many of those that can afford to do it certainly cannot afford to pay the devastating cost of $80,000, $90,000, $100,000 a year nursing home costs if they don't qualify for Medicaid. So it's a situation that each case is an individual thing, and you have to decide how you want to protect yourself. That's why when I ask you to do this show on terminology, it's so important for people to understand what am I not talking about? What are you, as a nurse and as a director for Gentiva, what else do you see, Nancy, in the care community that people need to think about?
I think we touched on a lot of it, and really it goes back to how do you know what you don't know? And I'm going to point out again, Helping Seniors of Brevard. Helping Seniors of Brevard doesn't provide the care. It provides phone numbers and where to go for help. So if you have an idea, you need some help, and you don't even know really where to get it or exactly what type of help, Helping Seniors of Brevard is a perfect organization to call, and we can lead you to the right organization. We at Gentiva take phone calls all the time. People are always welcome to call us at Gentiva. The number is 321-725-4799. And if we're not an agency, if we're not what you need, you can at least call and ask a question. I would be more than happy, and my staff would be more than happy to say, oh, it sounds like you need this, and give you those phone numbers. Because those of us in healthcare have that are connected have a pretty good access to the other community resources. So anything we can do to help people, just pick up that phone and call and ask a question. It starts there, and people will be amazed at how much education, how self-educated they can become just by picking up the phone and saying, I need help, but I'm not even sure what kind of help I need. Here's my situation.
I think a hospital is in business to help keep people out of hospitals. Too often we think about the end result instead of how we can do something smarter about preventing the end result. You can't wait until you are placed in an extreme situation to solve it. It's so important. It's just like I had a phone call one day from a lady down in Barefoot Bay, and she lived on an income of roughly $1,400 a month. And she had to go to a doctor's appointment in Palm Bay, Florida. And she said, Joe, the cab fare is $74 round trip. She says, I really can't afford that and pay my bills. I said, you don't need to do that. I said, there's an organization called the Space Coast Center for Independent Living that has a contract under the Department of Transportation for the state of Florida, where the lady operates 4 wheelchair-equipped vans. So if you're in a wheelchair, she can send that van down to Mickle, Florida, pick that person up, take them to the doctor's office, and the driver will stay and go into the doctor's appointment if the person wants them to, so you have another pair of ears listening for what the doctor's saying, take them back home, and the rough cost for that is $30. A tremendous difference.
Right.
I went up there, and I'm hard of hearing, and I admit it, but they have a wonderful system at the Space Coast Center for Independent Living where they have 4 tonal modulated phones that they give out to the hearing impaired. And you can adjust the tone and the volume on the phone to where you have certain frequency losses in your ear, and by being able to make those adjustments, you can hear better. It costs us nothing.
But people don't know about these resources.
They don't know.
Right.
Yeah.
Right. Therein lies the problem. So ask a question. Call HSOBC. Call Gentiva. Call 211. Ask a first question, and people would be surprised at where that leads. Being educated is very, very important.
We're finding that the more people know about what is available, especially the most difficult area of our whole care system to reach on this has been the doctors. Most of the doctors I talk to, if a doctor finds out what we do or how we can help people, they become very enthused about it.
Yes.
But getting that letter from our organization or from other nonprofits through the system into the doctor so the doctor sees it is very difficult.
Very difficult. They're busy. They're busy people.
They're
busy seeing patients in offices. They make hospital rounds. It is very hard. And one of the things that we do, and we have representatives in the community that go out and do this, is we educate our doctors on, because we do home care, that's what we educate on, what home care can do for their patients. Because it is important, because many times the doctor is the only healthcare entity that a patient has contact with. So it's real important to keep doctors educated on community resources and different healthcare aspects. So even if they don't have a great working knowledge of it, if they just have a list of phone numbers or say, yeah, I heard of something here's a phone number that can help you.
Yep. I cheated and I glanced at my book here. We've covered everything except one little area, and it's called Respite Care.
Respite, yes, very important, yes. What is respite? Respite is basically it's a term that means having a person taken care of so that the family can get some rest or time away. Right. I don't know better how to articulate that.
No, that's what it is.
Respite services are available in home. So again, I'm going to go back to that son and daughter-in-law that are taking care of their elderly parent. They want to go on vacation. The elderly parent can't travel with them, but they can't be left alone. There are in-home respite services, so you can hire somebody for a week or two. You can hire somebody for several hours. Respite.
Yes.
You can just say, I want 4 hours. I take care of my dad every day. I want 4 hours to go to the mall and get the grocery shopping done, or maybe just have time for me, because the more a caregiver takes care of themselves, the better caregiver they are. So you can have in-home respite care, but also many of your assisted living facilities have respite rooms and beds available.
Well, they'll take care of somebody for roughly a week or so, or people can go on a vacation.
Yeah.
Yes.
Yeah. There's many around Brevard County where you don't have to live at that assisted living. You could just say, I want to rent that room for a week or two, and then that person can, it's as if they live there. They can go to the dining room for meals, they get their medications taken care of, but they're only there for a week or two.
Yep.
Yeah.
Over the next year or so, we hope to put our counseling network in place so that people will be able to ask and receive answers to exactly what Nancy and I are talking about. Thank you, Nancy.
Thank you, Joe.
It always goes too quick. But I want to thank you, viewer, for watching today's episode of Focus on Seniors. If you have questions or comments, please call us at area code 321-473-7770. For more information on senior care and resources, visit our website at helpingseniorsofbrevard.com. Be sure to listen to our Focus on Seniors radio show on radio station WMEL 1300 AM every Thursday morning at 9 a.m. And look for us in your Fly Today Health section of the newspaper every Thursday for our Focus on Seniors column. I'm Joe Steckler, and thank you for joining us today for Focus on Seniors.